Morning stiffness greater than 1 hour with symmetrical small joint arthritis. Anti-CCP positive. Most specific diagnosis: rheumatoid arthritis. First-line conventional DMARD for newly diagnosed RA unless contraindicated: methotrexate. Methotrexate hepatotoxicity monitored by which blood test every 4 to 8 weeks? Serum transaminases, ALT, AST. Absolute contraindication to methotrexate therapy: pregnancy. Sulfasalazine adverse effect causing orange discoloration of urine and oh no, skin tears, yellow-orange. Biologic DMARD inhibiting TNF-alpha administered as 40 mg SC every 2 weeks, adalimumab. Screening test for latent TB before starting anti-TNF agents: interferon gamma release assay, IGRA, or MANTU. SLE diagnosis: ANA sensitive. Which antibody is most specific? Anti-dsDNA or anti-SM? Anti-SM most specific. In lupus nephritis, class 4 diffuse, preferred induction regimen: mycophenolate mofetil plus corticosteroids. Hydroxychloroquine retinopathy cumulative dose threshold, brackets, unless 1,000 grams or over 5 mg per kilogram day over 5 years. Antiphospholipid antibody syndrome lab criterion: lupus anticoagulant or anticardiolipin equals uptick times 12 weeks apart. 2. Persistently positive. Livedo-reticularis and arterial thrombosis suggest catastrophic APS. Acute management includes heparin, steroids, ? Plasma exchange or IVIG. CREST syndrome. R stands for Raynaud phenomenon. Speak a prosody rate 120%. Scleroderma renal crisis doc to control hypertension. Captopril, ACE inhibitor. Ankylosing spondylitis radiographic hallmark in sacroiliac joint. Bilateral symmetric sacroiliitis, fusion. Modified Schober test assesses flexibility of which spinal segment? Lumbar spine. Bamboo spine appearance due to syndesmophytes occurs in ankylosing spondylitis. Psoriatic arthritis pattern involving dip joints with nail pitting named distal interphalangeal predominant type. Gout diagnosis confirmed by polarized microscopy showing crystals with birefringence, negative, needle-shaped. First-line urate-lowering drug for chronic gout? Allopurinol. Allopurinol contraindicated with which immunosuppressant due to bone marrow toxicity? Azathioprine, 6-mercaptopurine. Pegloticase is recombinant uricase and is used in gout refractory when serum uric acid is greater than any enzyme, milligrams. Pseudogout crystals composed of what? Calcium pyrophosphate dihydrate. Dermatomyositis pathognomonic rash on knuckles called Gottron papules. Muscle enzyme elevated most sensitively in polymyositis, serum CK, creatine kinase. Anti-Jo1 antibody is directed against which tRNA synthetase? Histidal tRNA synthetase. Sjogren's syndrome diagnostic Schirmer test measures tear wetting of mmM per 5 minute. 5. Sicca symptoms first-line systemic agent for extraglandular arthralgia? Hydroxychloroquine. Large vessel vasculitis with limb claudication, unequal pulses in a few-year female, Takayasu arteritis. Ilateral granulomatous uveitis with neurologic signs and systemic sarcoidosis treated with high-dose corticosteroids. HLA-B27 positivity is found in 90% of blank spondyloarthropathy, ankylosing. Drug-induced lupus most commonly associated with which antiarrhythmic? Procainamide. Antibody hallmark of limited cutaneous systemic sclerosis? Anti-centromere antibody. Raynaud phenomenon first-line vasodilator therapy, nifedipine CCB. Behçet disease pathogen test becomes positive within 24 to 48 hours. Colchicine toxicity manifests initially as severe gastrointestinal upset, nausea, diarrhea. Methotrexate pneumonitis CXR shows bilateral interstitial infiltrates and requires immediate cessation plus high-dose corticosteroids. Hyperuricemia targets serum urate less than or equals to 6.5 milligrams. Drug causing blue-black hyperpigmentation of cartilage and sclera in achronosis, hydroxychloroquine long-term. Churg-Strauss, EGPA, vasculitis asthma, eosinophilia, and ANCA positivity, P-ANCA, MPO. Wegener granulomatosis induction therapy combination, cyclophosphamide plus what? Glucocorticoids. Azathioprine metabolism affected by low activity of which enzyme leading to myelosuppression? Thiopurine methyltransferase TPMT. Leflunomide teratogenic active metabolite can be cleared rapidly with cholestyramine 8 grams TID for 11 days. Bisphosphonate prophylaxis is recommended when prednisolone dose is equal to 1 mg per day for 3 months, 7.5. ACR EULAR 2010 RA criteria requires score equal to 0 for diagnosis, 6, 10. Baker's cyst rupture in knee mimics DVT. Ultrasound shows fluid in, space, popliteal fossa. In acute salicylate poisoning, the initial primary acid-base disturbance is respiratory alkalosis. Serum salicylate level greater than X milligrams per deciliter warrants hemodialysis, 100 acute or 90 chronic. Paracetamol overdose antidote and optimal time window, N-acetylcysteine within 8 hours. Rumac Matthew nomogram guides treatment for WIT poisoning. Paracetamol, acetaminophen. Organophosphate poisoning, muscarinic symptoms, treated immediately with atropine. Oxime, pralidoxime, acts by reactivating inhibited enzyme. Acetylcholinesterase. Methemoglobinemia antidote unless G6PD deficient, methylene blue 1 mg per kilogram IV. Cyanide poisoning intravenous antidote kit contains sodium nitrite and sodium thiosulfate. Iron poisoning severe antidote, deferoxamine. Ethylene glycol poisoning antidote inhibiting alcohol dehydrogenase, fomepizole. Carbon monoxide half-life on 100% oxygen, about 60 minutes. First aid compression immobilization bandage is recommended for which snakebite class? Neurotoxic, elapid bites. Antivenom dose for Indian polyvalent ASV initial vials, 10 vials IV. Crate bite hallmark early neurologic sign, ptosis due to neuromuscular blockade. Scorpion sting, severe autonomic storm drug of choice, prazosin. Toxic alcohol ingestion, anion gap metabolic acidosis with calcium oxalate crystals indicates ? Poisoning, ethylene glycol. Beta blocker overdose refractory to atropine, preferred antidote, IV glucagon. Digoxin toxicity treated with digoxin Fab. Each vial binds 0.05 milligrams digoxin, / 0.5 milligrams. Cocaine chest pain managed with IV benzodiazepine and which antihypertensive avoiding beta blockers? Nitroglycerin. Speak with prosody, rate 200%, toxidrome, with hyperthermia, dry skin, mydriasis. Agent, anticholinergic, e.g., atropine overdose. Lead poisoning basophilic stippling, abdominal colic, chelator of choice in children? Dimercaprol plus EDTA, outpatient, oral D-penicillamine, or Suxamer, DMSA. Arsenic poisoning acute. Diagnostic test of choice? 24-hour urine arsenic level. Hypocalcemia, tetany after ethylene glycol due to precipitation of calcium oxalate. Serum osmolau gap normal range process 100%. Naloxone initial IV dose in suspected opioid overdose, microgram per kilogram, 0.04 to 0.05 milligram per kilogram, usual adult 0.4 milligram. TCA overdose ECG change predicting seizures and arrhythmia. QRS widening greater than 100 milliseconds. Alkalinization with sodium bicarbonate is cornerstone for which overdose? TCA, tricyclic antidepressant toxicity. Hyperkalemia over 6.5 immediate membrane stabilization drug, IV calcium gluconate 10%. Bite of Russell viper leads to coagulopathy via consumption of fibrinogen DIC. Latency period of paraquat herbicide poisoning pulmonary fibrosis, 2 to 3 days for onset, death weeks later. Paraquat ingestion initial therapy involves gastric lavage with 3S powder. Fuller's Earth, activated charcoal alternative. Hair dye, paraphenylenediamine poisoning causes cervicofacial onsta, angioedema or onema. Pufferfish, tetrodotoxin, blocks which ion channels? Voltage-gated sodium channels. Rhabdomyolysis indicated by serum CPK greater than EIU liter, greater than 1000. High-altitude cerebral edema prophylaxis drug, acetazolamide. Hypothermia moderate defined as core temperature Celsius, 28 to 32 Celsius. Snake antivenom test dose is no longer recommended. True, false? True. Frostbite treatment after rewarming includes prophylaxis with which antithromboxane drug? Ibuprofen. Heat stroke core temperature usually degrees Celsius with neurological dysfunction. Point 40. Severe cyanide poisoning causes venous blood to appear colored, bright red, oxygenated. Anion gap equation, Na plus K minus Cl plus Cl3, HCO3 minus. Salbutamol nebulization shifts potassium into cells and is adjunct for toxicity, hyperkalemia. Most common serious adverse effect of antidote N-acetylcysteine, anaphylactoid reaction, rash, bronchospasm. Speak. Prosody rate 120%. ICU patient accidental chlorhexidine ingestion management, break time 400 milliseconds. Dilution with milk water, usually benign. Say prosody. Speak. Oleander plant poisoning causes digitalis-like effect. Antidote, digoxin-specific Fab fragments. Bitter almond odor in breath suggests poisoning. Cyanide. Sea bather's eruption is due to larval stage of which marine creature? Thimble jellyfish, Lanuche unguiculata. First step in hydrofluoric acid dermal burn, copious water irrigation, then calcium gluconate gel. Dapsone overdose causes which hemoglobinopathy? Methemoglobinemia. Hypoglycemia unresponsive to dextrose infusion in sulfonylurea overdose. Antidote? Octreotide. Ingested button battery beyond esophagus asymptomatic child. Management? Observe. Repeat X-ray in 24 hours. Pyridoxine is antidote for seizures caused by toxicity of which first-line TB drug? Isoniazid. Tetanus antitoxin dose for prophylaxis in clean minor wound if immunization unknown. 250 IU/IM. Universal antidote historically comprised activated charcoal, tannic acid and magnesium oxide.